They're boys and girls in a psychiatric crisis seeking treatment for their mental health diagnosis. Through no fault of their own, they can be dangerous to themselves and to others, which is why it's so important that they be kept safe in our state psychiatric hospitals. But alarmingly, time and time again, patients are escaping from one state hospital here in Metro Detroit. 7 investigator Ross Jones is digging into why and how this keeps happening.
Hawthorne Center is extremely critical in our state. I know families who right now, their child should be in Hawthorne, but they can't get in.
For children battling the most severe mental illnesses, there is no place more vital than Hawthorne Center in Northville. There is always a waiting list to get in here, usually months long. The children lucky enough to be admitted are in need of urgent, round-the-clock care. Almost always, says mental health advocate Mary Ann Huff, they pose a danger to themselves or others.
Starting fires in their family home, threatening their parents and their siblings, and suicidal gestures, trying to hang themselves, overdose.
But as hard as it is to get into Hawthorne Center, too often we found it's easy to get out.
Northville Community Dispatch.
I'm calling from Hawthorne Center. We have a patient that escaped.
More than a dozen times in the last few years.
Hi, this is Hawthorne Center, and one of the patients just jumped the fence.
Patients have been able to escape.
Where'd she go? I don't know where she went.
Some missing more than an hour.
So he needs to be picked up because he's a risk to himself and others.
Gone so long, canine dogs were brought in to help search.
Unfortunately, it happens quite often.
14 patients have escaped from the hospital since just 2020.
Should patients be able to escape from a place like Hawthorne?
Well, I would hope not.
Last month alone, there were 3 different escapes from Hawthorne. For some patients, it wasn't their first.
I'm with State of Michigan Hawthorne Center. We have 3 runaway juveniles.
How many, I'm sorry?
3.
On January 31st, after one teen was able to gain hold of a staff member's keys, he escaped and 2 others left with him. They traveled a mile down Haggerty Road to this gas station in Livonia. Surveillance video shows one of the patients standing at the counter trying to buy vaping supplies. When the clerk asked for ID, he moves behind the counter, then throws a punch and tries to steal products off a shelf. The 2 scuffle, and more punches are thrown before the clerk calls 911.
What's going on?
Someone's trying to rob the gas station.
Seconds later, on the other side of the counter, another patient begins to fight with a second employee. The patient didn't have a weapon, but the man he was fighting with did, licensed to carry a concealed pistol. He would later tell police he nearly used it.
But I pulled it out, kept it in the holster though, because I felt like he might be a kid.
We were one trigger pull away from this becoming a tragedy.
Yes, it could have been a huge tragedy, and I really, really think that something has to be done about it.
Ali Saad is the owner of the gas station the 3 patients came to after their escape.
And if there wasn't another person here, God knows what this guy could have done. I mean, there's knives, there's things that he could have come and that he could have created some great bodily harm.
Both patients who came to Hawthorne to help stabilize their behavior would be handcuffed, now facing potential criminal charges.
To me, it speaks to the staffing shortage. It speaks to the fact that these are kids that have significant behavioral health issues.
The biggest problem, according to employees inside the hospital today, is that there's simply not enough of them. Today, there are 91 vacant positions at Hawthorne, with openings for 27 nursing positions and 37 child care workers. Hawthorne staff did not have permission to talk to us on camera, but off camera, they told us every day at the hospital is a struggle. Said one employee, "We have a lot of staff on medical leave or staff that recently quit because of the workload the hospital puts on us." Said another, who's worked there more than 3 years, "This is the worst it's ever been."
These are young people with significant behavioral health issues. We'd like to think that if somebody is in a state hospital, they wouldn't be able to escape from the state hospital.
Well, you would think state officials would want to explain how and why this keeps happening, but they refused an on-camera interview. Instead, they released a statement that reads, "The Michigan Department of Health and Human Services takes the health and safety of our state hospital patients and staff very seriously. We review all incidents at our state hospitals to determine if changes in procedures are needed. In all cases of elopement from Hawthorne Center this year, youth were immediately followed by staff. In all cases, youth were returned to the facility and the same day, And in 2 cases, youth were returned to the center within minutes of leaving. But just to reiterate what they left out of that statement, 2 of those patients left in handcuffs, and another had a gun pulled on them. So this is very significant.
And clearly, there's much more work in this area that needs to be done in this state as we try to rebuild what was dismantled in terms of mental health care.
And they say they're going to get some security that they hire in to try to keep things a bit more secure here. It's not there yet, and hopefully things improve quickly.
Ross, thank you for that. I know you'll keep following that for us.